pull the presentation up. Oh, it's going to be that small. All right. So this shows the state and county for county administered when the state is actually the one. This is when we're delivering the service. So California and North Dakota tend to be higher than the state and county per capita. And then you take a look at the drop down to Ohio, Wisconsin, New Jersey, and the other states that deliver this service in this manner. And they're all a little bit different, right? Barb talked about it the last meeting. This then shows when you go to the non-county administered states, we do then, of course, jump to the top when you take a look at the state and county added in. Here is when you add in the highway payrolls, North Dakota again. And when we talked about this at the county administrator meeting last year, North Dakota is kind of like Minnesota, well, not like Minnesota. They have more of a hybrid. They actually have some county delivered and state delivered services. And then again, this shows with highway, we would go on top of the ones that are non-county delivered services. Here's where it shows the states and counties for the public welfare and health. So California would be at the top per capita at a little under 25, we're a little over 20, with North Dakota and Alaska between us. And then when you add the highways in, we go above the state of California per capita. Again, with Alaska and North Dakota, small populations but large states, why they're per capita, when Joe explained that last time. So then he took a look at all governments. So if a city is providing, right, Minneapolis and Bloomington would be examples of providing some health and services. They would show up in the census as well. California still remains at the top with North Dakota and then the state of Minnesota. And for the non-county delivered, where the state delivers a service, Minnesota is higher, again, for all governments. When you add in the highway payroll, we're right about that third again. And then we are at the top when you take a look at the non-county administered. Here's all states, right in the top 4, and the top 5 when you add in the highway. Vermont, for some reason, now begins to come in. So the other thing you asked us was some of the state of Minnesota trends, and this is where we are now running out of capacity to answer some of these questions. We don't have enough analysts in Scott County to do some of this. So at some point, I think this would be a great graduate student or something like that to take a look at some of these trends. But this is full-time equivalent employment at the state of Minnesota from 1992 to 2025. This is the state, all right? Their employment, their FTEs. So from about a little over 1,500 to over 4,000 in that time period for a state that doesn't deliver services. That's one of our questions, right?
That's just for, it says public welfare, so
we included in public welfare, that's the social services, that's going to be DHS, DCYF. So you can see in 23, you are going to see a trend with the state of Minnesota on upward bound.
And that's where, like Leslie was saying, I think like this is one thread that we started to pull on, and this looks at it from the census data, but I think we've got some other MMB data. But maybe it starts to tug at some of that inefficiency piece that we're doing, and that's where, like, there's a conversation that as we look at like all kind of government entities that do this work, is there an opportunity to kind of envision how it is that we do this work together? And like we can't just all of us in isolation continue to grow in a different way, right? Where we don't kind of look collectively at how we do this work, and this is a piece of that.
So Wednesday, we did present to the county administrators that trend of increase in how the levy, but it's kind of interesting when you take a look at some state data that Jake has pulled here at the end. This is full-time and part-time public welfare.
This is payroll.
This now is the full-time employment, again. And then the part-time, just broken out. Here's health. So this gets to MDH now, Julie, to your question. So that is a different entity, right? and looking at how they report in health, there's your full-time and part-time. That gets to be their payroll again. This is interesting because this has to do with a reporting change they did on their part-time employees. But here's health, full-time employment. Here's highway. I kept telling folks when I was at MnDOT they were cutting people and nobody would believe me, but it does show that in the early 2000s they went through a thinning process and changed their model on the delivery of some of their services. But again, coming out of 23, even they show an increase in their staffing. Here's their full-time and part-time, where they've gone from a payroll standpoint. Again, the acceleration in this last 3 years. Here's their part-time employment is actually down quite a bit, their payroll. Here's their full-time employment, just over 5,000. So this is all the state of Minnesota employment functions, FTE, so just under, what is it saying, 70,000 to now they're just under 90,000 over that time period. That's what the data is showing us.
Does that be county, local, state?
Nope, this is the state of Minnesota,
Just state.
all of the state employees. Yep. And then this is their payroll at 200 million to just south now of $700 million from the census, the 22 census. And then he projected out some of their data from MMB.
Now look at the last, let's say, 4 years.
Yeah.
Yep, that's
Ouch.
what we're talking about. Where are those dollars going if they're not delivering some of those services, right?
And this one again is just state, or is this one?
This is just state. This is the state of Minnesota. One of you had asked that question, and he actually, that kid just dug into whatever he sent you a paragraph, I think, even. So then you've got your all government function, full-time employees, again, kind of looking at that.
So can you just go back to that slide, please? You know, there was a reference of one of the programs, and talking to one of the senators, and like, oh, no, those aren't the numbers, they must, they're lying, they don't know the numbers. Coming from someone high up in the Senate, let's just say. If we presented these numbers, and people try to poke holes into them, what's our confidence on this?
Well, this is census data that would get used by a lot of people to do research. I still think I would like to ask MMB for the very particular numbers from them from their budget, that we're having a discussion about what we asked for. So give me 1 minute here, Commissioner.
Well, and none of this is surprising, right? This is all stuff that we know and feel and see, but.
So this is very interesting. This is pulled from MMB's own data, right? This is from the state of Minnesota. Keep going to the growth trends here. We had enough. So Jake actually pulled this from the state's own data. So the population of the state of Minnesota was 3.4 million in 1960. The county levies at the time were $113 million, right? The state general fund expenditures were $250 million. The federal funds were $258 million. So if you add those together, and not all county levy goes to the state, right? This was just showing what the three were equating to in the state of Minnesota. There's your percentages. So now you go to 2025, the most recent data, obviously, that we could get. The population is 5.8, so it's gone up 2.4 million. It hasn't even doubled. The county levy has gone to 4.2 billion, all 87 of our counties. The state general fund expenditures are 35 billion. The estimated federal funds coming in are 23 billion. And then the total of 63. Now, we've obviously had inflation. Things have changed like schools. So Joe, when he got that from Jake, dug in and put it into $26. If you looked at the county levy in 1960 and $26, it would have been 1.2 billion. We have less than double that population, and we're up to 4.3. And obviously the state would have been 2.8. Let's say you doubled your population, you'd be, what, 6 billion? But we're at 36, and then the federal growth. So there's clearly a growth in service, clearly a growth in what we're doing, what we're providing. But this is from their own numbers based on the current inflation rate of $100 in 1960 equal to 1,088 today, or whatever that magic number was.
And then I'd love to see another column where it has outcomes. Which I know we can't always, but wouldn't it
You
be
know,
interesting?
and there were shifts in the state, right? They took over school funding in the 70s. It came off the property tax. So we aren't showing the school district levies and things like that, but their levies have tended to grow back, right, where they've been allowed to do it. So it just gets back to what Barb said. It's looking at the big picture and duplication and bureaucratic overhead, and how do we take a look at how we're delivering these systems?
Well, and back to your comment, Dave, on somebody who might look at these numbers in one way, they might be like, look at though, your county levy percent is less than usual. But the big numbers, that growth, we've had no influence on that big growth. So I mean, I think we have to be ready to talk to that if we're gonna use these numbers. Because there's some people are gonna say, well, dang, counties should be paying more. Look at, just a couple years ago, you were paying a bigger percent of all services. Well, we don't have control over whether those services are offered and who gets them.
But what you need to take a look at is where the services are going.
Right, but that's,
If you take a look at that 113 million, it was not nearly as much social service.
Well,
roads
so,
and-
yeah, so the county levies on there are a percentage of the estimated total cost of government services in Minnesota. And in the previous slides that Leslie had from Joe with the census data, that percentage gets smaller because the state keeps growing, payroll keeps going, so that total number of the cost of government in Minnesota keeps getting bigger. I think we've probably done more than our fair share as counties to try to keep up in a way with those costs, but because the state growth has been so fast, especially in the last 5 years, the percentage of our share has gone down, even though the numbers, I mean, it's more than doubled since
2010 to
2000.
2025.
It's gone up almost $1 billion in just 5 or 6 years.
Right.
The other thing I'll say, I think the trends from the census data and the data here are solid. I think you can say, yeah, those are the real trends. Take with a grain of salt any of the data. I think any of the data, the census data, the data here that's pulled across multiple financial sources. I think as Barb has suggested, we probably need to get the data from the state. What is their version of this? And then engage in some dialogue.
But we know what that's gonna show.
But here is some interesting information too. You
Which
saw
we still
their-
need it.
You
Right.
saw their staffing numbers go up, their payroll go up. But we've always had 87 counties. At one point in 1952, we had 5,800 school districts, and we're down to 330 or something like that? So you can see where the consolidation has been. The counties have not done that. We have 826 municipalities, 1,828 townships. And so in 1950s, when this 1960 data, we had one watershed district. Today we have 90 SWCDs, 46 watershed districts, and 23 WMOs, plus the DNR and the Corps of Engineers who regulate water.
But we don't have any new rivers.
So I mean, it's looking again at the size. We were the third largest in the nation for the amount of levels of government we have within our state. And so when you've been asking us all these questions, it's really nice to have an intern that can do some of this
Yeah,
digging.
it's great.
It's the first time we've been able to pull anything for you, but this is about as far as we can take it at this point, just so you know.
But, and I think we gotta be careful not to let people just start poking holes at numbers and say, we're talking about trends. Every single one of these data is showing the same trends, and that's what we care about. I mean, yeah, I don't think we can argue the 2010 to 2025 state general fund expenditures. Whew, that's a verifiable number right there.
Correct.
I mean, we're gonna find out in a couple days. I mean, we have AMC royalty in the house, like our own internal AMC royalty. 47th vice president or whatever it is. What is it? Soon to be. And I mean, so what is gonna translate down at St. Paul, y'all, this year? Because they have to see this. and recognize it's not, none of this is sustainable. I know we're gonna have new faces,
Right.
but what, until, I feel like until counties are, one or more are
No.
facing bankruptcy or banding together to say, no, we just are having a year next year, 10 years from now, and it's new faces around this table and banging our heads at the same old issues.
Well, I think that Julie and Matt did a really nice job on Wednesday at the county administrator. It was a great meeting. I know Matt probably felt a little bummed up after it, but
And it wasn't
Really?
even there. It was only good because I wasn't there.
Really?
they really presented, I thought, some really good ideas on this shift, on some change, and how do we get it down, identifying the problem. We are the right people to be working together,
Yes.
and we can do better.
Yes.
I hope they talk about it later, but it was really, really good, so.
If you don't mind, I do think to your question, the pain point that will make this a discussion that's mandatory at the legislature, regardless of who's in control, is property taxes. That is real. We know you guys are dealing with it statewide, we're dealing with it. It's probably gonna be higher average levy increase than last year. The city's school districts are in the same boat. And I was reminded at NACO that Minnesota actually, as a percentage of people's income that goes to property taxes, it isn't, across the nation, ours isn't the highest. It's not even in the top 10. But what's different in Minnesota is the other states where they are higher, they don't have income tax, or their sales tax is lower. So when you put that whole weight
Yes.
of the tax portfolio on households here, it is higher. And people are feeling that because property taxes is one of the most felt taxes in our state.
Yep.
So I do think both gubernatorial candidates, regardless of who gets elected, have property taxes in their mind and will probably force conversations about what is possible with the scale of government and what needs to change for a vision. Because I also don't think that revenue options, if it's Speaker Damith, that's probably going to be a conversation about what's going to change in forms of government, what services are going to change. If it's Senator Klobuchar, I still think those conversations could happen, but for Democrats in the House, I don't think they're going to be as confident as they think about, oh, we'll just raise revenue. There's not many more tools to raise that revenue, and I don't think either candidate is in the mindset that we're going to entertain these broad scope requests to raise huge amounts of revenue at this point. So we'll come back down to scopes of services and what's achievable. And one of the things that your Commissioner Weckman-Brecky and folks on your team have been working about is that huge storm cloud of LTSS, the waiver services. Like that is, when you look back and we look back to the MMB reports, for 2 years, Governor Walz has been screaming through his MMB presentations, this is on an unsustainable path. So much so that, chairs of the committees are not happy with them, right? Because they don't want to cut service. They don't go get elected after they're working in nonprofits, providing people services and say, oh, elect me so I can cut them. But I think the governor is pointing out at this moment, like, it's responsible for 50% of our $1.4 billion overage in health and human services costs. So we have a deficit the last 2 years because we are spending more in health and human services. It's not the revenue side that's letting us down, it's our expenditures are up. And 50% of that is disability waiver and residential services. So I think that's going to be a really tough conversation this next 2 years, regardless of who's in office.
And it's why we're wanting to engage, and we're jumping ahead, but why we want to engage now during campaign season with, I say this all the time, with the people who are asking for your votes. People running for the legislature, people running for governor, to talk about what our solutions might be to this challenge, because everybody's looking for ideas and none of them are easy. And so we're really trying to think about how to talk right now about what these pressures are and highlight some opportunities for change that are in the conversation that you all have been having all the time about how do we get more efficient with all those government resources that Leslie just showed us in slides, and achieve many of the same things, but by rethinking how government's delivering them, because the actual cutting of services is really hard for legislators, but we need them to see the challenge with spending and where it's headed and what that looks like if they're gonna be in office for 2 or 4 years between now and then, so that we can tackle it sooner.
And I know we need to get back on agenda, but I think this is really pertinent to your question, Dave, and what Julie and Matt just said. But we need to focus on those big pictures and trends, because the legislators, and I'll give an example from Barb this morning and from Senator a couple weeks ago, even now, we know our staff always try and be good stewards of the dollars. And so we get appealed a lot and things like that happen. And for example, Barb got an email from Senator Hoffman being blah, 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 you didn't give somebody this, blah, blah, blah. She got to send it on because it ended up not being our person. But I've gotten emails from Bill Liskey about that too. Senator Liskey, pretty opposite sides of the aisle. When they get calls from people they know and love about how government didn't give the level of services they want. And I think we saw that this year. And so all the work we've been doing, a lot of us, to say this is where we got to keep the service level, the folks in the legislature on both sides, when it impacts the people they care about, 3 people, they're doing that. And so somehow we got to stick to that big picture, and we got to get people like Hoffman and Liskey to hear this message, because so far they're not. I mean, right, Matt? I don't feel like Senator Hoffman is hearing the message one bit.
No.
And it needs to be prescriptive enough that our staff aren't trying to make individual decisions, and that we're being able to, because I don't know how much time Suzanne and myself, Brittany, are spending on individuals that have a waiver and they're upset because we didn't give them the right X, and then they're calling and we're spending hours every week on these phone calls.
When we have the most generous, arguably, waiver system in the nation. I mean, I saw a Center for American Experiment report, which, you know, we read all sides of the aisle, the reports, but what was interesting is that MMB, I think, has used their data too, or come up with the same data, which shows the average waiver cost in Minnesota is the highest in the entire country. By a lot. I mean, it dwarfs it by 5 times the lowest amount. So it is something where I think we can point back up. You want us to say yes to everyone. This is how much it's already costing. How do you expect to pay for this? Like, and if the idea is 5% of the cost will be on your levy as a localized thing, that's just not acceptable. But Barb, the point, sorry, one other thing I thought about on those slides is what that you guys put together is, so the cost of payroll, the cost or the increase in staff numbers, that to me is huge. Cost of payroll, but if you're thinking about it, $600–700 million is only a fraction of the state's total expenditures. So really what is interesting is the service costs. I don't think even the staffing levels, even if we're pointing towards the states getting bigger, it has to be the service costs that are driving things, even more so than just simply the staffing numbers.
I think it all points to your LTSS, your Medicaid, that number that just is skyrocketing, right? I mean, that is what is driving, I think, all of that, Matt.
So now, after all that, we are to some of those impacts on the county and putting together the 2027 proposed budget. So we're going to talk about our preliminary budget status, or proposed budget, I should say. The act and its impact and what we're doing to address that. Our financial forecast, regional rail authority, look at the budget calendar, and then we'll talk about the HHW special assessment. So just a reminder, our board budget policy, long-term fiscal stability while minimizing tax impacts, reasonable level and constant tax burden, focused on modeling limited and relatively level increases, and managing limited resources over unlimited demands, and provide the level of service necessary to meet mandates and citizen expectations. And then what we mean by fiscal stability is a structurally balanced budget, maintaining the county's reserves or our fund balance, maintaining the county's bond rating, plan and prepare for the future, and don't spike the levy, no surprises, which we have not been as successful in the last few years, but we've been trying very, very hard. So the preliminary budget. Major budget drivers are state and federal legislative changes. We have the impact of federal SNAP administrative cost shifts, impact of the act. Our overall state revenue is down from last year by over $800,000, but HHS has offset the majority of that revenue loss with a reduction in spending cuts. And then we're looking at addressing some structural budget issues that we have of ourselves. This budget does not include the LTSS county cost share shift. It also does not include the SNAP benefits shift. It does include $1.6 million in cuts identified in 2026 that are applied for 2027. And if we hadn't done that pre-work and the work that has had vacant positions and all those things, we would be in a much worse position than we are right now. And so the proposed levy increase sits at 7.83% is what we would expect to bring to the board in September.
Where do we look when we look at the Metro and certainly the 87 about what we're going to budget for and what we are not? Because there are some decisions being made
So it's.
whether to budget some of these items or not.
So I think the majority, except our neighbor to the east, because of the fund balance issue, after the discussion Wednesday, is tending not to budget for all of these shifts. And that we can't afford it. We can't, and this state needs to figure it out. I can't tell you statewide, Julie or Matt might have a better, but I think, you know, we're all putting a little contingency in there, but not budgeting, and that the primary thing that AMC and Micah and folks need to focus on is the LTSS and the SNAP error rate, that the state has to pick those up.
I mean, it feels like we counties are long past the line in the sand. I feel like right now we have to, as many as we can, like you guys, have as many counties have a line in like, I don't know what, the diamond that it's just hard. It's just, no more.
Yeah.
Enough is enough. We're beyond even that. We're beyond enough is enough. It's just, none of this is sustainable. I mean, I'm heartened to hear that you think both flavors of teams that are going to be coming to the top are going to be willing to have these hard discussions. I'm not going to rest on that, of course, you know, because we know how that changes. But at least it just feels like that hasn't even been a conversation. Like it just keep patching, spending, these trends that we see, and let the next crew worry about it. I don't know. It makes no sense to me.
And I feel like these are really the places to draw the line in the sand, because both, you know, one state, one federal, they're state and federal programs. Like it's not even at our role as an arm to administer. These are the costs of programs to wholly determined eligibility benefits without. So I would add, I mean, I hope others see it that way.
too.
Even though there's a whole bunch to choose from, and I know some companies really want to do the act or want to do this or that. This is just so clearly, why would we be paying a portion of somebody else's actually program costs that they determine?
Well, and that's where it feels like this is an opportunity in time. That if there's some number, whatever that number is, that have the resolve and the courage to say no, like we're holding the line. Because we all go down and make noise, testify, write letters, Facebook, whatever, which is all good stuff. We've got to keep doing that. But, and we get maybe, I think like community corrections. Oh, you're going to get a little relief on this. Oh, wow, this is amazing. Oh, but you can't do fees. And like, wait, did you just put something in my front pocket? I'm missing something in my back pocket. Like, what happened here? And then we're all grateful and thankful and make some noise, and we just get sat at the kids' table. Like, oh, that's adorable, you cute little counties. You really making a mess down here, but we're going to give you some crumbs and sort of appease you. And
Okay, we're gonna keep going, Dave.
I hope not. I hope we're not.
I will answer the question, which is, I think this feels in keeping with what we're hearing from most counties in terms of the shifts on the table and where they're budgeting and not budgeting. I mean, there's gonna be individual counties that do individual things, but what the choices you're making sound like what I heard a lot of counties talking about throughout district meetings, or the choices you're proposing.
So what the budget includes, we have the $1.6 million in reductions from last year, an additional $6 million, or $600,000, not 6 million, 100,000 in 2027 budget reductions. This does include bringing in our merit increase to the budget that we've talked about, where that's always been out of vacancy savings in the end of the year, as well as our over-complement positions that have been on the books for, in many cases, many years.
Some of these go back to 2014 and 15, and if you have an over-complement for 12 years, it is a needed position.
And then budget contingency, $720,000 for unassigned revenue that we've been trying to get out of the budget for years. One thing different for this year is that we didn't know our health insurance costs back in June like we normally do because we were moving to that 1/1 of 2027 year. So this shows the change, that increase in the health insurance from what is currently in the budget.
So this is an additional add on what was already.
So we updated our rates for the 8/1 benefits year, and we had that short-term year. This is the difference in that for that entire calendar year of 1/1/27.
So year over year, what's the increase?
So the average the last 3 years,
Has been about 10%, last 5 years. I don't have the exact year over year, I can get that.
So 26 to 27 is a 10% increase, you're saying?
Yeah, it's 9.7% total from, if we looked at 8/1 of 25 to get us through our 1/1 of 27, it's about 9.7%.
so when you see the 5-year model, we have increased, right? The 5-year model's always been kind of low. We have changed and updated some of those increased the last 5-year averages to put into that model.
We have $600,000 increased transfer to fund balance within here. $557,000 contractual increases, so not as high as what we had forecasted, but we're trying to get to that. What you have asked for is, can we come down from the model as opposed to always being higher than the model, so we're working on that. $235,000 in funding for the ACT, $172,000 for MnChoice's flat reimbursement, about $83,000 for SNAP administrative cuts. One-time state funding is spreading the impact of that over a couple of years. We have library extended access coming onto the budget, having to take on the non-emergency medical transport funding shift that was supposed to be taken over by the state, and then the behavioral health funding shift of $35,000. So the recommended positions cut, we have a project manager in OMB, we have 2 child protection workers in HHS, and we have a senior public works technician in physical development. These were all positions that we held in 2026. We said we would evaluate what can we do with these. We have other ones we'll show you in a little bit of positions that we are not proposing to cut, that have been held so far this year and are likely to be held through the end of the year. So the ACT funding plan, we had a big dollar amount a couple of years ago, or last year, of what this impact was gonna be. And HHS has been working hard to say, how can we mitigate this? So the first one, we had $128,000 for data and case review. The expectation is that supervisors are gonna take on this review responsibility. The concrete supports, we took from $234,000 down to $50,000 with fund balance as a backstop. We don't know what this is gonna mean, right? We've heard stories of different things that would hit concrete supports, but we don't know what that actual impact is. And so instead of levying for an amount that could be high or low, we have the fund balance as our backstop for that.
Suzanne, what was an example though that somebody was ordered to do and then at least it was reversed?
Hennepin County, who's a phase-in county for the ACT, was at some point ordered to purchase a vehicle for a family. I think that eventually got walked back, but I think for the phase-in partner counties, there is concern in terms of what the parameters are around the provision of concrete or economic supports for families.
So just know, this is one, we're at 50,000. If something were to exceed that, it's coming out of the fund balance.
And in consultation with our county attorney's office, like they had suggested, which I think was really, we think it will be helpful, like setting out a standard operating procedure around like how we will envision the use of concrete supports. And so we've got that we are finalizing and we'll be sharing with partners. So appreciate that support.
And I assume that's going to focus on getting concrete supports from all kinds of other places, like
Correct.
Not helping people get concrete supports, not the county providing the concrete
Correct.
supports.
And connected to really short term, like if there's,
Yeah.
if it's not a sustainable plan, like then we're not providing concrete supports. And it's how are we accessing already existing resources and supports, how are families and extended communities helping support it. And then if there's a short-term gap to support safety planning or prevent removal, then that's when the county would consider.
Okay, thank you.
Contracted services, so this is our ed neglect truancy work that we've just reported out on over the past summer. We had $500,000 kind of budget for that. When we came in with the contract, it was about $360,000. we're using the one-time funding for the act to spread that impact over a couple of years. So for 2027, that's about $135,000, another $100,000 in 2028.
And what's in that number? Like, what
So-
groups are in that number?
That's like Catalasso, St. David's.
Those are the positive ones that showed the impact.
So our FRC additional support, so this was originally the amount of making sure we could bring the FRC funding off of ARPA funding, which had been supporting it this far. Right now, we are proposing 0 ongoing levy on this. As we've been reviewing our fund balance, we have a couple of $1 million we had set aside from the CARES Act. So if you go back to COVID, the CARES Act, we got this large influx of money. There are usable expenses, including law enforcement, public health, staff time. And we had a very short amount of time to utilize these funds. So we booked what we could to that revenue, and this has kind of been sitting here in a committed fund balance that the board had committed to this purpose. So this seemed to align with that, and we'll get into more details, but we want to utilize this money for that FRC additional support. We have
Which is consistent with how we have feathered in programs.
So it's a fund balance designated for such use versus like some other counties who've been scooping from fund balance to try to offset without any kind of
We
backfill.
didn't put it into ongoing, you're right.
Which I believe that to be true, I just needed to
Yep.
ask that.
Family group decision-making, funding for $50,000, and all these all of these are designed to fit the requirements of the act of things that we believe we're already doing to try and provide those supports up front. So the 2027 levy increase, a total of $235,000, and just noting, this is offset by $297,000 in cuts to 2 child protection workers to fund the activities required in the act.
And can I just add, like, I want to emphasize the importance of, at a time where the vast majority of other counties are ramping up child protection staffing, like, it's pretty incredible that we are at a place of actually shrinking the footprint. So, I just think it's an important call out because our other county colleagues are looking at how do they add to their child protection footprint.
So a little bit more on the Family Resource Center, and I invite those who know more about this to jump in and correct me, but the Family Resource Center and what we're proposing here was a board strategy. Develop and implement a plan for leadership and sustainability of the Family Resource Center. So HHS folks have been working on this since we adopted that board strategy. So we we released a request for proposal for a nonprofit to operate the FRC, which we talked about earlier. I mean, we had one entity respond, and we're currently in negotiations with that potential vendor for operations of the FRC. Like we said, we plan to utilize the CARES Act funding. It aligns with the original intent of the CARES Act, and it aligns with our fund balance policy to fund strategic initiatives with one-time dollars. We've done this before, right, folks? We've used it for specialty courts. We had federal grants, they needed a one-time match. We set aside fund balance, and we kept bringing it back saying, do you want to bring this onto the levy? We've done it with PROACT when that became expensive costs, where we provided one-time funding that we had set aside in fund balance. We did it again when they had to get a new building, and now they're completely off of any county support. So sometimes it takes time, but using that one-time investment with that goal has been a successful strategy for us in the past. Providing that one-time funding established over several years will allow the vendor to operate the FRC and refine their operating costs into the future. They'll be expected to conduct private fundraising to offset county support within this as well. And this should cover 3 years of operations, just what we've set aside here.
So how much CARES money for the 3 years?
Approximately $1 million. I don't have that. I know they're still in negotiations, and I know we can't say too much, so
It's about
that's what we've set aside.
$300,000 a year. And then we're providing the facility, right? So we are still committed to providing that space and access to that space.
So what's gonna happen in 3 years when there is no funding?
So we'll have to evaluate that over the next 3 years, their operations, working with them to refine it. As we said, we want to be a partner in this, but not the primary driver anymore. So what does it look like? What are their efforts? I believe they've already been looking at some other outside funding that could support their operations.
They've had when we sat down and had a conversation with them about this, they have shown a strong commitment to really wanting to get into the community, to build relationships, and to look for other funding sources. And it did not feel like lip service. It felt like that's how they live out the mission of their nonprofit. So I think there's interest in us walking alongside with them and making sure that it's still fulfilling the mission and the outcomes that we need, because we need it connected to where is our county role, why would we even need to have this partnership and contract. And so I think we can still hold that to be true while they're trying to establish themselves financially. So.
And I think there's broader work both at the state and federal level in terms of what is the opportunity to leverage different funding streams to help support child welfare prevention strategies. So like FRC is recently named in Title 4B, I believe, at the federal level. So again, how can that happen strategically in the state of Minnesota here moving forward?
So, correct me if I'm wrong, I see some of our leverage after year 3, to Commissioner Ulrich's question, in, requiring still attention to the outcomes we need based on providing the space and some capital or infrastructure, but also maybe helping them get some of those funding streams. So hopefully, like I feel like we have a connection after year 3 more than maybe in similar type examples.
So just like we've brought you back the data and the information, you will start to see some of that data. And I'm assuming maybe even in year 2, if they've done some fundraising, it might change what that looks like. Or in year 3, you will then have time to make a decision to feather in and to work through that based on what the outcomes are and what the state and federal laws change to as well. So,
Well, further in the past has meant the county's going to pay for it.
I would say that there has already been interest in hitting the ground running on that with some contacts and reach out to some foundations. So I think this is, even before the ink is dry on the contract, there's been interest in how do we do this, both from our side and theirs. So,
And you'll be able to tell us this provider once you come to us with the proposed contract, is that right? Are we looking at a timeline in a month or 2?
I mean, it's already told us the provider in the
What's that?
past, I mean, really, right?
Well, I
But they
guess,
sat at the table for not really a reason a month ago, or 6 weeks ago.
I just think I'm trying to honor the RFP laws here.
right.
Yeah.
yeah.
Okay.
Soon.
Okay, I just, like in a
Well,
month.
you didn't so much as say it, but you're so stressed.
It probably won't be surprised.
But I think this aligns with the goals that the board has set out for this, right?
Yeah.
We have been working in that direction. They've done a lot of work in trying to find these partners on this. And part of this is, and we just had this, last meeting, the Wilder benefit cost ratio. So they attributed 75% of the CP avoided child protection involvement to the work of the FRC. 23.3 events, estimated benefit of $603,000, and total savings from avoided child protection involvement of $106,000. So $1.21 benefit to each dollar invested in cost for benefit ratio. The key takeaways, the child protection involvement among FRC families declined. Improvements are consistent across the program years, and the county's rate declined more than Carver County's after FRC involvement. So I know this worked, they pay for themselves, and this is a floor, not a ceiling. I just want to make sure I attribute, this is all Wilder slides, just to refresh our memory though. And so again, for a $497,000 investment, we saw a $604,000 return on that investment for a net benefit of $107,000 based on their analysis.
And maybe some intangibles too.
Yeah, these are just the conservative. If you remember that discussion, there are other benefits and the outcomes to the families are
I
better.
mean, like I said, maybe a kick out beat 'em.
This is really a narrow look at the return on investment, because again, broader across the nation, return on investments for FRCs look at much broader outcomes and impacts. We intentionally looked at what is the impact to our deepest end of the system, which is the child protection.
And moving off the FRC, as a reminder, these are the 2026 positions that were held: child protection, adult mental health caseworker, community services division director, senior legal assistant, and equipment mechanic. This is one we need to continue to evaluate over the winter. We need to have 2 people in the shop whenever it is open and somebody's in there. We have to get through the snowplow season and see, can we actually manage that? But that's when that may need to come back in along with the other ones, but we're still evaluating that. An infrastructure enterprise architect, business relationship manager, in that position we plan to bring back in a different capacity going forward, and then a senior GIS analyst. I also do want it to be noted, and I think it's happening across the organization, but HHS, I think in particular, of the reworking vacant positions that has been happening left and right to try and meet those other state requirements. When you look at the income maintenance requirements that have been put upon the organization, the additional work that's required from InChoices. I think Barb had a spreadsheet of all the different moves that they were doing and sharing to try and meet those. Still cutting positions that we have in here and not having to come back and ask for more positions to meet the demands that have been put on our staff during this time. And we know that there's been a lot of additional work required on that.
So we held these in 2026, we're continuing to hold them in our 27 budget, or we're saying they're gonna be filled in our
We're going to
27?
fill them.
Okay,
Ron needs his position, we need a CS director.
thank
The
you.
one we're gonna continue to look at is the equipment mechanic. Troy and Brad are taking a look at that. I'm the one that says we need to hold it just in case, because I get worried when we have to send a mechanic out to plow that we don't have enough coverage and we cannot have a single person in a shop. That just violates every law, rule, safety there is. And so we're sure, we only have 5 to begin with. And so that's one we're watching.
Well, I think that'd be the same for the shell protection, like, I don't think we want to cut it, given the act, given the change in the age of delinquency, so we will continue to watch, but not cut the position. and
Okay,
not hire
so
right.
some of these will still be held in 27.
At least 2 of them
Yeah.
will be.
But it may not be, so we promised to hold these positions all of 2026.
Right, it might
That
not be.
may not be that same situation of where we have to backfill in 2027.
Okay, thank you.
And some of them might not come back as listed. The brim will come back as a different lower position. I think Brad's trying to debate between a GIS analyst and the planning position they've lost. So there's some discussion on what it will be, but there's still a gap in the org in that area.
And then areas that we want to continue to look at before we get to the final budget. So reductions to the scene and elimination of the residence report. What is the impact of that? What are potential savings? Evaluating our MICA membership. Historical society funding, where does that need to come in at? We want to look at our burial costs and how we've been doing and trying to bring those down. We also are exploring, can we consolidate out-of-home placement, because not all things fluctuate and are high at the same time, right? If we have a consolidated fund, can we reduce the overall budget between the separate areas that have out-of-home placement and have it go into one source with, again, fund balances backstop?
And I know we hit those 2 highlights for AMC that we talked about, but I am really worried about kids in the continuum of displacement. The JAF is struggling. We have issues, obviously, with the change in the delinquency law that is creating issues, but somebody has to start taking a look at the placement of kids and those programs, because we're one of the 10 biggest counties. We cannot afford to operate a JAF on our own. I mean, we can't. And when you take a look now at some of these kids coming in, if one takes 1 per 1, now we can't use 2 other bedrooms, we can't bring kids in. And as some of these cases have become more complex for our staff, we had 2 of our staff injured in an incident that are out, right? We're funding at bare minimums per our direction here, but now we're down, and now that pushes more pressure, and now we're into overtime and other issues. And so this continuum for the placement of kids needs to be a highlight from the high acuity to the secured to the non-secured. And it is really a big issue here, I think, in the metro area. So
The JAF is our juvenile alternative facility, unsecured. We have a county-operated, non-secured one. We've taken kids from a lot of counties.
Is that conversation, I know probably a different agenda item, but there was that conversation about, hey, almost like a fire district of sorts, with Metro and even outside, is that still on?
It's still there. I mean, I think that the challenge is going to be, and I think what we saw last session is that, like, due to all of the changes with HR1, due to the state cost shifts, it was hard to get our voice up over the top for the need there, and I think we're going to have the same issue here too. Like, I fully support the SNAP and the LTSS benefit pieces being like primary, that we have to, we shouldn't be figuring out as a county how to pay for benefits for clients. But at the same time, we have all of these other crumbling pieces of our infrastructure, and Leslie articulated the pain that we're feeling at the JAF, like, readily. And if we remove it, then all of the kids that we have really needed it in social services this year, and we don't have an answer for them.
Yeah.
And we have all of these other facilities that are closing. So, like, our focus being on those is fantastic, and it should be there, but we got a whole big problem also that we got to keep working on.
And this is an infrastructure issue, the facilities and where they are and who's operating them. It is a problem.
Yes, but I'm just saying, is that an ongoing, because it sounded like a year or two ago, there was a, like, let's just take it on and fix it ourselves, meaning.
Yeah, we
Metro.
did meet as a Metro recently, and I think there is interest in continuing to look at this. I think we need to maximize the amount of beds that are out there, but we still get into a funding issue in situations. So as Leslie talked about, like, we need to have a daily census of X here in order to hit and to meet our budget. And that brings us to bears, like, exactly optimal staffing needs if we don't have any issues. And so right now we have people that are out on medical leave for all kinds of different reasons. And so they are barely making it from a staffing perspective right now. And we have all of these other client issues. So it's a piece of the puzzle that fits right now, but is it the best way to design it? I don't know that.
And we haven't had to place somebody out of state, but you could sit and listen to Anoka or other counties talk about they're having their staff fly out like on the 30th and meet with the client and the family, and then they do it on the 1st, so they try to get one trip to cover 2 months. I mean, we haven't had to face that yet, but there are our partner counties that have.
Have the additional Hennepin County high acuity beds, have they helped us, or they filled them up themselves, or it just hasn't been our need?
They have filled them up themselves.
Okay.
And I mean, we have a good partnership with Hennepin. They have utilized our JAF, and they have been a good partner to work with, but they still have needs that I think swamp their own boat.
Okay, so didn't help us there, because they invested a lot in those beds, I think.
They did tens of millions.
Yeah.
Okay.
We're gonna be looking at our E911 funds to, in the short term, fund some of our dispatch costs as we're moving to our shared system with Hennepin County. There's some increased costs within there. We're looking at gravel pit funding for parks levy offset. Looking to see whether we can use dedicated funds for some choose not to use costs that are currently in the budget. And then we're looking at whether we should use innovation program funding for mortgage foreclosure relief that we're seeing.
So this was a program you'd approved in '23, and Julie has brought it to our attention that they've had a couple mortgage issues come in, not rental, and it tends to be seniors who are struggling. And so we're taking a look at how we can work with some of these folks to make sure they're not evicted. So we would reduce that in, I think, our fund balance hold from what you had allocated, but I think we still need a few dollars in there to continue some of that.
And is this an area just, I mean, it should always be, but just in the days we're living in, we have really good safeguards on that and feel like this is really important uses and the need is real and.
Yes.
But those are still to come. Those are places that we've been talking about for a couple of weeks, but, and Leslie probably in some of these days more, but we need to do more investigation into.
And the E911 fund isn't for increased costs. It's looking at, can we use that fund to offset some levy? So that's really what that program is about.
Now looking at our financial forecast. So for 2028 through 2031, we're still only projecting 1% revenue increases, down from where we're at 3%. Now it seems like 5-6 years ago. We have our estimated salary increases within here. We do have 10% health insurance increase. This is a change. We looked at the 5-year historical average and we were sitting at 9.44%. It goes up and down, but that average is sitting right there at almost 9.5%. Insane. We have 200,000 increased transfer to fund balance, and then we still are allocating $1 million a year for contractual increases. We see that fluctuate. We can be at 900,000 this year, only at 500,000. But even some of that is because the CIP helped us out this year, so we didn't have to bring that on to levy. So as we look at this, 2028, we have the contractual increases in the fund balance. We also have the SNAP administrative cuts. 2029, we still have $450,000 in community corrections fee loss. 2030, we're going to be adding $100,000 to the CIP. And the same thing in 2031, where those are the primary changes that we're seeing in that financial forecast.
And so Julie and Matt, just see our 5-year model, there's 2 things you're seeing today. One was the update on the investments in the quarterly report. And then this one is the 5-year model that we can't be below 5% 2 years in a row of our fund balance. Those were all things we made to improve to a AAA bond rating. And so our 5-year model is pretty important for us in trying to look out for those reasons. It's part of our fund balance policy.
Quick question, when you say contractual increases, is that contracts with providers or is that contracts internally with negotiating with CBAs? If you have salary increases?
This is not contract, it's not bargaining agreements. Those are out, and those are part of that salary increase. So this is, we have IT contracts going up for services. We have cleaning contracts, some of those sorts of things. Things we have an obligation to pay in some way or another. Outside though, that's a good clarification.
Did you see, just for AMC, that there's a paper towel dispenser with a mini Windex that we're getting rid of cleaning? Just you grab your own paper towel and you clean up.
I've not seen that one.
No?
So
We're gonna have 1 garbage can in the whole building.
Oh, we have cut back on those.
Yeah.
Yeah, that's from company.
Gotta do what we gotta do. I love it. It's good.
So here's the graphical representation of our 5-year model. So this is the levy points at 7.83%. You can see when we looked at this just yesterday with the CADVIN, we said we want to increase that health insurance to 10%. That drove that arm up. We did have a more downward trend with that goal of trying to be as accurate as possible into the future.
Well, that's always the question, like we don't want some forecast like, oh, you know, this is good for this year, for the next 4 years, like, and that's where I was always asking, like, hey, where have we tracked 5 years over 5 years
Well,
over 5
Leslie
years?
has it all on her
Yeah, I
board.
know.
Want to come into my whiteboard instead.
No, it's great, and not as a gotcha, just as
No,
a, you
it's,
know.
it's a change also in kind of how we've done it. We've been refining this. I think a couple years ago, we went through the refinements of our 5-year model in the last 8.5 years since Leslie and I haven't been in our roles. But the blue line is our percentage change. We're at 8.36% in 2026, 7.83% for this year. The red line is the actual levy dollars. So if you take that 104 million, divide it by 96.6 million, you get that 7.83%. And then the green line on the bottom is the percentage of taxable market value that we are going to be bringing in as our levy. This is one that for many years we've really been looking at bringing that down 20 to the next. We are for 27, but our forecast is now showing that we are projecting we're going to be taking a larger chunk of the taxable market value than we have in the past. Chef.
Unless we do something different.
Unless we do something different.
Danny, can I, is this an okay time for me to jump in and just make a comment? That if that trend line is alarming, and that it probably is, I don't think we're taking into consideration, correct me if I'm wrong, the OMB uniform guidance change and all the potential impacts of that. So there's real operational risk for every local government across the country, and especially counties, that there are political appointed reviewers for federal grants that lets agencies just sort of, I think from our perspective, arbitrarily terminate federal funding. So the level of risk that is totally unpredictable from that uniform guidance is not depicted here, but it's something that we should all be keeping in mind going forward.
Besides that guidance, any federal shifts that come, right?
Correct.
Over the next They're not in.
And where is that? That's one we have to talk to the House now, because the Senate at least delayed it till December.
The Senate delayed it to December
But it
11th,
doesn't.
but the chambers have to reconcile that before September
Before
30th.
September, so that's right now,
So we
immediate.
are reaching out to our members of Congress to explain that we're concerned about this across counties in Minnesota and ask them to support the delay.
Yeah.
I think that's
That's
the
all we
most
can do, right? Let's
realistic
get it
ask
delayed.
at this point. This is really in-depth, wonky stuff. But that's what we're attempting to do to assist counties.
Leslie, does the projection in the out years, the out 3 years, does that include full assumption of the SNAP benefit cost share?
No,
So
you'll
we'll show
see a
that here in the
slide
next couple
that-
slides.
No, I don't want to see it.
This is
Sorry.
saying that you are successful in February, April, or March, or May, whatever that might be.
Pressure.
I mean, he's got a tan suit.
Yes, yes, I love it. High confidence. I love it.
So
Next slide, next.
the next slide shows our operating budget, and really the important line is the green line here, but it shows our fund balance. So the yellow line is our projected operating budget, the red line is our projected fund balance at the December 31st of the preceding year. So you take the red line, you divide it by the yellow line, you get the blue line that shows what our fund balance is at the end of the year. The green line shows where our fund balance is likely to be towards the end of May when we start to get our first property tax distribution. So as we pay payroll, grants, all those things to get reimbursement. And under our policy, if this goes below 5%, Leslie and I have to bring back, how are we correcting this? So we look at this every single time we present on the budget to make sure that we are staying above that 5% within here. So as we talk about state funding shift, our revenue again declined by $815,000. HHS reduced spending or add offsets of $700,000, so a net impact of $114,000. I heard a legislator talking to a city that said, well, we had this funding issue and we worked through and we found the money in the budget. Well, we know where we found the money in the budget. It's right here in this $800,000 that probably other counties are also experiencing as well.
And what, the reduction of 700, like what is that roughly? Is that
Like,
just,
it's across all of their areas. We don't have to do this. We can cut back on this. We don't have to do this because we lost this funding. It's
The
a
kind of
pretty
thing we've
long
been asking them to
spreadsheet.
do every year.
but it's not like a couple big chunks, it's just a lot of,
There's a couple of bigger chunks, but there's also a lot of little things within there as well.
There is, and I think some of it too transitioned from, at the end of last year, there were some positions that we didn't fill that moved forward, and there was some pass-through dollars that we didn't fund. There were some contracts we cut back on, so yeah, it was a little bit of trimming everywhere we could.
And Barb, but some of the positions we shifted, I'm gonna say from licensing that were totally levy, because the
We did.
state doesn't fund that,
Yeah.
that you shifted to generate some revenue.
Correct.
So there's some shifts there, Commissioner, as they've been managing these positions, so that looks a little bit different as well.
Right. With it.
So current statute shifts $851,000 to the county beginning July 1 of 2027. This does not include the proposed budget and would equate to almost an additional percentage levy. It also increases $1.5 million for 2028, not including the 5-year forecast. It would be a 1.36% levy increase. Together, $2.3 million in funding shifts that we're going to be pushing against that are not included in this budget. So this shows if we added, based on current statute, so starting on July 1 of next year, put in the SNAP cost shifts and the LTSS cost shifts. So we would go up to an 8.71% for 2027 and up to a 9.9% increase for 2028 with those cost shifts.
So those are each a good percentage point higher.
If we keep the 7.83% budget and we wait and those impacts do hit us, we're gonna have to absorb that all in 1 year, and that's a 10.85% levy.
And I would say that this is even, the numbers that we have are
Right.
slightly conservative too.
On LTSS
We
especially.
could get the worst penalty as it pertains to SNAP, and I think if you look at like the, how the LTSS has been accelerating, I think we went with the 10% increase. and it's roughly been like a 20% increase every, so like this could definitely blow into 11, 12% range, so.
Do you guys see counties like at a spot where like, okay, we're done. We're here. We've been shaking our head. We've been dealing with this. We've been finding out ways, but we're done. This is not happening.
I
Some heaven or
characterize
water.
it, I mean, I think the answer is yes, though I might characterize it a little differently than that, Commissioner. I think every county is feeling the pain of these cost shifts and saying we can't do this. So I think we're gonna see a lot of local government power coming together in the next year to make this not happen. And it's why, I mean, we've been working on it, but why we're
Yes,
starting out with
100%.
people as they're running to make sure they understand before they take office. I say this all the time. While they're running and listening to you about what you want is the time to lean in, and these are the things everybody is leaning in on. And that said, the state has its own budget problem next year.
Right.
Yep.
And so,
Right.
we want to have these things at the top of the list of things that all the newly elected legislators and the new governor are thinking about. And then they're going to arrive in St. Paul to a picture that's not much rosier than what you all are talking about. And I think we are gonna have to be laser focused as a statewide association on the things that have the most impact, because we aren't gonna get everything we need. Not want, need. We aren't gonna get everything we need. So what are the, like, mission critical? And I do think there's a lot of agreement, significant agreement on what's mission critical, which is the best position we can be in, I think.
Yep.
Well, and I think even of our local delegation, those who are gonna stay in place and those who maybe are gonna come in, and again, good people have good contact with them, but I don't know that their top priorities going into January, you know, our friends and neighbors are these things. They have some other top priorities. And so I think that's the work that, you know, each of these counties have to do in order for the association to do that work, because if we're not saying that
Yes.
to our
yes.
friends and neighbors, and I don't know that they even heard that last year to the degree we needed them to.
And we're
So-
not alone. The schools are in this
Yeah.
shape too, which helps us because, I mean, honestly, we'll get to this later about the spice but nice. We've been spicy. And so we've lost political chips up at the Capitol with how direct we've been about the unsustainability of some of these things, which you have told us be louder, and we are listening.
Shut
But it's
doors on.
important to still have political capital at the Capitol too. And so I think it is helpful that the schools are in this boat. What kind of concerning about this trend too is that our message has sold well for counties about HR 1, about unfunded mandates. But as you look to these budget slides, I mean, the majority of your budget increases are due to contract salary increases and other things, and health insurance. Those messages are tougher to talk about. And it shows that even when you're talking about a 7.83 potentially this year or in the future, your next year budget went up about 2% or 2.5% with this huge assumption of SNAP, but still the lion's share is those the costs of doing business, which speaks to the system is broken at its core.
And that's, Matt, what it shows, right? Because those salary increases, if they were funding and not capped, right? That's the difference in the slide we showed you on child support
Yeah.
versus child protection, which they cap it, and then versus child licensing, which they don't fund any of,
Yeah.
and it's
Yeah.
a state mandated service. So when it's not capped, Barb can submit it and it's picking up the health insurance and it's picking up the salary increases. Those other programs, they cap them. And it's not picking that up. So that increase, you can say it's salary, but it's delivering the programs they're
Yeah.
mandating us to
Still,
deliver.
the cost
That's
shift
a
our
very good way to say
because
it.
they're not paying for the cost of the service we're providing.
Correct.
Yeah, this top bullet, when I started here 8.5 years ago, was about a 3.2% in revenue increase that we projected. And that was primarily the state funding things. And about 4 or 5 years ago, we reduced that projection to be 1% because the state just was not, they would take and add money here from where the noisiest place we were, and all of a sudden we'd see a funding shift and reduction over here. And so it's not keeping up with the cost of services. And I think what we'd argue is, if you're telling us how to do it, what systems we have to use, we can't be more efficient, and you're not funding any of the increase anymore.
You know, I would go to Children's Mental Health, and I know they get insurance, but our levy has still done this. They mandate the caseload, they mandate the system we have to use, they mandate how we do the program, and yet they have nowhere near kept up with the levy increases.
But they are funding us to some level. What is that number?
$34,000 or whatever it is. I mean, and yeah, we get some of the offsets from insurance and those, but the levy has still done this.
Yeah, yep,
Yep.
that's important context.
We need like 5 of those bullet points.
So moving off the regular levy and talking about the Regional Rail Authority.
So off the rails, back on the rails.
Now off the rails, now back on the rails. So our intent is to propose to bring the levy back up to $400,000. We brought it down to $200,000 last year. Want to go back up, primarily to build funds up for potential future rail purchase, again, of that Montgomery and New Prague Union Pacific line. I don't know, Leslie, maybe you heard more of the potential abandonment, substantial cost of $2 million. It aligns with that trail plan, so we have funding set aside to be able to build that county's regional trail, provide trail connections to the southern portion of the county. Other funding sources aren't readily available for this sort of purchase at this price. And we want to be prepared to be able to cover these costs in the future if needed.
Yeah, this is one that I'm also, Commissioner Ulrich alerted us to, probably maybe some potential changes on the Dan Patch, which is to the east, which would be a tremendous trail and crossing if it actually did come to fruition. And so both of those are hanging out there. And as you know, when we bought the UP for MJT, which opened, we have the ribbon cutting in less than a month, it was several $1 million to purchase that corridor, but we had it in the regional rail, and then Carver County was a partner with us and used their regional rail. So I think it's important that we get back to that number we had been talking about, because these are things the general public uses and are supportive of utilizing, so.
Well, just one more comment. You know, obviously the Dan Patch line has some kind of commuter rail or light rail or whatever is hated by most all. You know, whether it's, you're talking Burnsville, Lakeville, Bloomington, United, none of them like it. You know, they're very, very resistant. And I think that's just never going to happen. And what everybody would like is to have that be a trail. And they just would love it. I mean, I don't think there's anybody I've heard that would be against it being a trail, you know, for bike and ped and so forth. And it would be one of the most fantastic trails that we could ever hope for. So it's obviously, you know, maybe it's a 10-year dream or something, but it's not tomorrow or the next year. But you got to build up money and you got to be ready, and you got to take the steps to be ready. You know?
And that's one of the things we've always done, is capital money will come at some point, sometime, for some reason, and if we're ready to act, we can do that.
I'm probably a little hesitant to do that. I mean, I know people love our trails. It's one of those amenities that probably don't, people love amenities, they don't always use amenities, but if this is one area that would have to give on, I mean, that's some other things.
Well, I think when you look at what we've invested in capital for this area, right? You determined not to use sales tax for trails, that's hurt us.
Which
we
can
have
change,
cut-
right?
Well, it can't now, but you cut the levy in Road and Bridge, which funded some of these trails. If something shifts with the Transportation Active Sales Tax at the legislature this year, which is one of them I feel they're going to target, we're stuck. This is the only way we can acquire those rail corridors.
Just to comment on rails as opposed to parks, I'm surprised that rails are often more used than the parks. I mean, the biggest park use system in probably the entire metro area is the chain of lakes. Calhoun, Lake of the Isles, Lake Harriet. I mean, that overwhelms the usage of your average parks. I mean, even our trails that we put alongside county roads, you know, those are fairly heavily used.
So then we're bringing forward 783 for the preliminary levy in September. then we would bring forward the $400,000 for the regional rail. That's our recommendation. They can't go up by December, they can go down.
So the regional rail would be preliminary, is preliminary, true, if I needed that reminder.
We can or we can set it. We have traditionally set it
Oh,
in
we said
September.
it in September.
You don't have to.
We don't have to.
It's tough, yeah, I know it's tough. All the other stuff.
Can you let me just pull up? I just want to show, just so they can see here. I don't know, what room are we in?
You have to join the meeting in order to share. Do you want to send it to me real quick? While you're doing that,
Yeah.
we'll move forward. We can come back to it. So,
There you go.
with the budget calendar, on September 1st, we're going to be bringing back the draft CIP. December 15th, preliminary levy adoption. Depending on direction, the final regional rail authority levy adoption. October, we're going to get into our budget book presentation, starting with an introduction and then moving through our objective areas. We have the board planning workshop for November 19th. December 3rd, the budget public meeting, and December 15th, the adopt the final levy budget CIP. You send that to me.
I think I'm gonna skip that number 15.
Be down to 3 votes.
Might need you guys.
You'll have.
I'm not sure about
Go
that.
to slide 23.
Maybe I'll text you stuff.
You will be there. It's set for the day you want it, on a Thursday.
Chair,
not on a
chair.
I told you when you're setting it,
Chair.
I'll be there. The outgoings are never there.
Oh, yes, they are.
Well, they've never been.
Yes, they have.
Yeah.
They've been at that
Beard
meeting,
was at
for
it.
sure. Uh-huh. Uh-huh.
I'll ask
Play the
Commissioner.
tape, play the tape.
Beer, but beer
It's the
was.
23rd.
Beard was there, wasn't he?
23,
No.
yeah.
I don't really think the outgoing. That's your organization for 27?
No, but it's the final budget, which you have to approve.
There's a lot of things for your
There's a lot of things that you give direction.
Finishing well, finishing well.
Whatever the three of us.
So, Commissioners, this is just a reminder as you're thinking about this. Now go down, Danny, go down a slide. This is my problem.
We go. Was a commissioner cell.
I vote with you.
I gotta get there. So the reason I'm bringing that up was just so we can show that issue. This slide shows,
You gotta tell Danny what slide. Because you're not sharing, he's doing it.
I know that, but I'm just trying to
Oh,
get to the
sorry.
slide.
Oh, okay. Sorry, I thought you were
Because
telling us.
I can't read it from there. My eyesight these days. I don't know, I can't even find my computer. So there, this shows our experience. So this is child support. So when we talk about it, Julie, this shows child support. The gold is our program budget. The kind of brownish one there is the federal grant. The state grant is the very bottom, the gold, and then the blue is the county levy. And so the spikes up and down usually have to do with a payment that we receive coming maybe in January instead of December or something like that. But it shows you how we can be fairly level and kind of plan and understand those increases when it's an uncapped program. They actually pay our actual costs, correct, Barb?
Yep, so there's 66% of whatever our costs are. So that's why.
Federal government.
Yep, by the federal, yep. And so I think that's where if we could design a funding model where it was always like a dream
Yeah.
world, right? Always
Totally.
negotiated, 66% by the feds and let's just say 15% by the state and whatever's left for us, right? Then you would be able to have a predictable budget based off of that. But I think you're right, or somebody had said it here, when we have increases
Yep.
and the funding stays flat, like it's more of a shift than that comes
Yes.
our way. We're paying more of the program costs.
Totally
over
does.
So the next one then goes to a different story. So this is child protection. So when you take a look at this, we pay the second highest share of child welfare costs in the nation, which I think our data shows. Nationally, according to Zant, the local share is 10%. In Minnesota, the county share is 44.5%, because again, they capped like some 2015 number that they pay off of. It fluctuates based on caseloads. Doesn't matter if you're getting positive results in the community, then they cut your funding. But I mean, so this,
Is this because this is a legislative pot of money that has a set amount in it? None of, this is not forecasted the way a lot of things in human services are. Right. There's a DCAA.
But this is the thing we've identified with Angie Thiessen. I know she's probably talked to several of you here as, aside from our LTSS and SNAP requests next year, I suspect child well-being and protection will be one of our top priorities once again. Because it's the main driver for your budget, and once again, that box is a great story. This is driving costs, and you're making us pick up 40% of this cost that is mandated, and we are the second highest per capita in the entire nation when it comes to us picking up the highest local share for these services. So I do think this is one when we're talking to Senator Ports and leaders there, of like, we actually want leadership for you to set that tone. We have current funding, and what is it, 353 a year, what's the child protection grant?
That is impressive. That's
We have, and our question that Angie is asking is it better to just pump money into that because the formula works, or is it better to redirect it to math but type activities? So we are figuring that out, but I do want to just note, we think this is a good opportunity for next year. So if you're talking to Senator Port and others, socialize that with her.
Well, and I think that's why MACBA became such a surprise to so many, is that you were trying to build really some pretty significant infrastructure and a really crumbling a foundation. We didn't have a good spot to start with, and that just made it so much harder.
So we were already operating in a deficit essentially, and so like, some might say you're exaggerating, but the system isn't sustainable, and then now you've layered another layer
Which
of
is
mandates
crazy
on top.
how, I mean, when I saw that you were only raising it 280 per MACBA, my jaw almost dropped because I just did not expect that to be so low. I
And
thought that
I'm
you were
not
gonna do.
surprised.
And
I
we're
thought you
cutting
were gonna do
2
1.5 or
positions
2
to offset
million.
it. Yeah.
But that's because of the work that you've done.
Right.
FRC and otherwise, that has really
But also staff taking on more,
refocused.
which is something that you'll have to figure out too, because that pressure builds. I mean, when you have people doing child protection and case review and it's all part of their, that's gonna be a lot.
Right.
this
I
is,
do think the funding formula, sorry Leslie, is an important thing to examine. Like, I was a big advocate initially on, do we pump it into the child protection allocation? And it incentivizes, right, you have to be in child protection.
That's
And
right.
so is there a different way that you create a more flexible pot of money so that it can actually fund the things that actually, at least locally, we're getting the outcomes that we're
That's a
hoping
great
for?
point.
I'm
this
so happy
is,
to have
now
this.
this is licensing. So this, the gold again, or the yellow, whatever it is on top, is the program cost. The blue is the county levy for a state mandated program, and the brownish one on the bottom is the state grant.
Child care licensing?
This is child care licensing.
And adult foster.
And adult foster care.
Foster.
Yep. So we wonder why the state should take this one on since they're out doing some of this already.
Correct.
All right, what's the next one?
Children's
This
services.
is children's services, so this goes to show you, again, the program costs have gone up. We're not even showing what we believe the act is going to do. But our blue, that's the levy, it's the only one that has gone up. The Fed and state share kind of go up and down. They've gone up a little bit since that 20-year history. But again, we have outspent our state and federal partners in our increase.
And what's included in that number?
That is child protection costs, this is children's welfare costs, out-of-home placement. That's, oh, this is my favorite. The board knows that. This is children's mental health. So the blue is the program, the orange is the levy, the green is the federal grants going down, and the blue is the state grants going down. Now, again, there are some insurances in there, and I'm fine, that's great, they help fund it, but look what the levy is doing.
Yeah.
Mandated program. Go ahead, Danny. I think we only have like maybe one left. Oh, and my only point on this is we like the children's mental health schooling, mental health funding, right? We have done it since like 2006. We have a mental health center. It is a great partnership we have with the schools. But you take a look at the orange, that is a non-mandated program that has gone from over $200,000 a year to just under $800,000 a year in a state grant. If that was going towards like children's mental health, right? That would take care of that gap in that mandated program. So we do these other types of programs because we like them and don't fund our mandated programs.
The other thing I'll say about this is that you could look at this as like another funding model too. So School Link Mental Health is really, for us, it's operated through either insurance that we bill, or we're able to tap into the contract of the school grant. So it's really uncompensated care. So it's another way to cover costs if you can't meet that through insurance. And so either you could do the child support, FFPFP, where you're 66% of the cost, or you figure out a way to fund the unfunded mandate too. So like bill insurance, uncompensated care needs to go a different direction. So there could be some different funding models. We just don't have that for most of our areas. So.
And my only point is we're off doing things we like to do and not funding our mandated services, which I think this county board has been trying to say.
Yeah.
So what's the next one?
Community corrections.
And this is the last one, but this is corrections. So again, the program is in gold. The board continually did not increase our funding in this because the state wasn't keeping up. The levy is again the blue, I believe, and the state is the one at the bottom.
Feds at the bottom, states the.
But below us. And so the point is the levy's going up. Finally in 22, 23, you guys get down there with some of the bigger counties. They increase it. Now we don't have a formula yet. We have to start jacking ours back up again. And then they're taking away the $500,000 in fees, right?
Yeah.
So we don't charge a fee if somebody can't afford to do it, but there are plenty of people who can afford
We
it.
got a lot of rich criminals here.
And so that's why we have been arguing, Matt, but again, no listening, no support.
No.
It just puts it back into.
But it's like juvenile delinquency. It's the same thing. I mean, the amount of time that Emilio spent with reporters, for any of the county attorneys in this room, with advocates, with legislators, with leadership at the last hours to say, listen, we're already one of the few states who are headed this direction, but every single state creates carve-outs for murder, rape, physical, like violent crimes, and we're not. Like, what is this going to be? And I don't know. I don't know why that's not resonating.
But this is our last one. So I mean, this is just, so you can say it's salary increases or health insurance, but it's to do their mandated program.
Yeah.
That they don't keep up with the funding.
And that's what Matt and I just said, we need to like have 5 bullets in there about why county salaries going up is a state legislative problem.
That last
No,
5
this is a
slides
good connection.
showing that.
So I think you've given us like the places we can look for that. That state mandates require you to have a certain level of staffing that then you have to absorb the cost of.
And certain levels of education, and now we can't even name people certain, right? I mean, we're changing that and all kinds of things, so.
No more social work.
Yeah, I know.
Anyway, we'll turn it over to you and your slides.
Oh,
so.
do we have Kate first?
We were gonna do Kate
Oh,
next.
Kate, I'm sorry, I was just leaving Kate out. I didn't mean to leave Kate out.
It's gonna be exciting.
Solid waste is the future. It is a legacy issue. That's why I'm glad your paper had it in it.
All right. So next is the solid waste special assessment. I'm gonna turn it over to Kate to kick us off on this one.
Okay, so before we discuss the solid waste special assessment, we should probably take a step back and just do an update quick on the Dakota Scott Recycling Zone Plus. So we had the groundbreaking in April, and all of you were there. It was a really nice day to start off our partnership, so thank you. Dakota and Scott staff, we've been meeting monthly, and they give us updates on where the construction is at. I've got the last picture, I think they took that about a month ago, so they're moving along. They're also in the process of hiring the staff that will operate it, and then hoping to open, have that grand opening April, we hope. That'd be great, right before people start to do that spring cleaning for the graduation and the reunions and all that stuff in 27.
So this is a partnership we have with Dakota County, Julie and Matt, to have a shared ASFALT hazardous waste site, kind of on the border of Scott and Dakota. It's in Lakeville.
Yep. I'm ready. So before we began construction, we had to amend the JPA, which had those preliminary estimates in it. So the preliminary estimate for the capital, for the cost of the building was 3.6, and we actually came in under that at 3,419,000. The ongoing capital replacement and maintenance in the JPA is a preliminary estimate that was in there at like 62,000, and that went up. The initial will be 82,000, and then the ongoing will be 97. So that is the capital replacement and maintenance of the building. That initial is the cost of the large equipment that will need to be purchased. So there's going to have to be a front end loader, forklifts, compactors that they'll be purchasing over the winter. We have a separate agreement for the waste disposal. So that's the reciprocal use that we will have with just Dakota, the cost per car, so that's the salary and the disposal cost of the waste of the resident coming in. The $30 per car is a really nice deal. The reciprocal use that we have with the 7 Metro, it's $35 a car. So we actually have a savings by just working with Dakota County. And then that little note on that bottom there, that 400,000 annually to pay back to the general fund. And that's a note that we were setting aside $400,000 each year to get to that $3.4 million. So when the construction started, in our agreement, Scott County had to pay 2.9 million of our 3.4. And then when construction ends, we'll pay the remaining 10%.
So you saw that in Scott's presentation today for that payment out of the general fund.
Next slide.
So, do you want to
I can take it.
keep going?
Okay, so the operating budget for the Scott HHW and the RZP, that is, we use a special assessment for that. However, the special assessment needs to support more than just the HHW and the RZP. And because our other revenue is not keeping up with our cost increases, so that is due to our state revenue staying essentially flat, which you guys know our score and our LRD is not increasing substantially each year. It's flat, and then our permitting revenue is also staying flat. We do look at increasing that when we do the fee schedule update. You know, we look to see if we can do a 2 or 4%. We're very thoughtful about when to do that and if it's really needed, because our permit fees are already high compared to other counties around us. So the special assessment fund balance supports our hazardous waste, solid waste, and recycling programs. And Danny's going to get into more of that and showing you our budget.
So this just shows from 2016 through 2026 what the special assessment support is going towards. So our total revenue, not special assessment, is the blue line there, relatively flat going back to 2016. The total expenses are the orange line. Obviously that spike up in 2022 was the increase for the Recycle Zone Plus with that Dakota County partnership, but you can see we were already starting to separate from those other revenue sources. And then the special assessment is in the gray line. You can also see our SCORE funding. So back in 2016, it was actually at $500,000. We're back up a little bit above that now. But that special assessment was supporting all those areas where weren't having enough money in order to meet the state mandates that for what we have to operate.
So Jake, SCORE, because we're not just HHS here, Matt and Julie. SCORE statewide.
Yep.
What is the
Oh, I
percent?
thought you said score, I thought you were asking, is score statewide? Yeah, that was an easy question.
Oh, yes. Score is woefully underfunded.
Yeah, perennial.
So talk about what it is, yeah.
Yeah, so it's, how much detail do you want me to give here? So it comes, it's funded through the solid waste management tax. So just keep in mind, people are already paying a tax on the solid waste system. And, right, the state keeps that, and we have plenty of people in the room who can correct me when I get any of this wrong. 70% of that solid waste management tax goes right into the environmental fund, which is not the same as the arts and cultural heritage. I think there's some easy confusion around that. The environmental fund is effectively the MPCA's primary funding stream. So it's not all for solid waste. The environmental fund is larger than that. But the solid waste management fee that gets collected, those taxes go into that fund. 70% goes there, 27% goes to the general fund, and 3% goes to SCORE funding. I think it actually goes to the resource management account, which is not exactly the same thing as SCORE, but for our purposes, just think of them as the same thing. So 3% of those taxes that are collected go to fund this system. There's also an annual appropriation that goes to fund SCORE. Last biennium, I think it was 18.5 million, so that's the base. And then I think the bump up after 2023 is from the 2023 legislation that added that 3%, that carved it out of the general fund. Senator Dibble has had legislation the last few sessions that hasn't gone anywhere, that would reduce the amount going to the general fund and increase the amount going to the resource management fund over time. I think for the purposes of this conversation, it's important to remember that the state is already collecting dollars to cover the cost of solid waste management. But because so much of it is being carved off to support the general fund, we're having to continue to increase special assessments to cover, again, what we're mandated to do by the state of Minnesota to manage solid waste.
So Kate's message is the same as Barb and Suzanne's message.
And this is just our projection going forward, and I would say for our total revenue, that's probably been maybe a little bit rosy of a picture, but we tried to look at history and project that forward some. You can see our expenses are going to continue to go up because we have the same salary and benefit cost increase to maintain the current levels, and we're not seeing that same increase in our collection or our revenue from the state or from our fee increases, where we don't want to get, we kind of have taken two directions with our fees. It's try and cover the cost of service, but also don't get too far out of line with what is regionally acceptable. We look at the regional partners and say what is acceptable while trying to cover as much of the service as possible. So this is our household hazardous collection. So revenues for fees and reimbursements on the top line. This first is our Scott household hazardous waste cost to operate that facility. We have salary and benefits, we have operating costs, we have our capital needs set aside, and then we have our waste management costs for taking away the waste. Then we have our regional operating costs. So the cost per car projections are paying back the county for the $400,000 and our ongoing payments for fleet and equipment. So this gets us to a special assessment need for 2027 here of $2.1 million. When we look at all of the solid waste programs, and a lot of our overhead costs are allocated to household hazardous waste collections right now, we go down just a little bit, but it's just under $2 million is what we need in 2027 for our solid waste special assessment in order to continue our operations as they currently are. That equates to, in this forecast, going up to $32.63 for our rate. Each dollar of special assessment, you can see, generates a little bit over $60,000. Our rate has only been going up, the collections on the current assessment, about 1.5%. So that doesn't keep up with inflationary or salary and benefits costs for employees. And very sensitive today on the computer. And we do have a fund balance of about $465,000 that we project to have at the end of 2026 within here. So just looking at a little bit again, these are the 27 through 2032 rates that we would need based on that flow. We're actually recommending setting the special assessment at $33 through 2032. Our projections are that we'll be able to cover the full cost. In 2032, we go down a little bit because we fully paid back the general fund that $400,000, right? But that $33 will allow us to remain flat, using some of that fund balance for some of those high years and low years, so we're not over levying in perpetuity for this, but setting it at that rate, especially as we have some increased costs and inflation within there as well. And so I'm gonna kick it back over to Kate, who has some kind of regional perspective of how we fit into that picture.
So this is the solid waste, the Metro solid waste fee comparison. I've shown this before, but I'm just gonna go over it quick because I think it's been a while. So we do collect our fees a little differently amongst the 7 Metro counties. Anoka, Carver, and Scott, we do a property base, we do an assessment on the properties. Dakota County uses their landfill fees. Hennepin, Ramsey, and Washington, they do a surcharge, so they do a fee on the amount of waste generated at the home, and the hauler collects that fee. So that's why their percentages were flat rate. So Anoka, Carver, and Scott, although we're property-based, we do have different rates that we have on our residential and non-residential. So what you're looking at there, those are all 2019, the fees, the fee rates, and then the total collected. Since 2019, Scott County was the only one to raise its fees. So what you're looking at for Scott County is the rate that we changed it to in 2023 from $20 to $27. I did try to go and get, reach out to the other counties and see if we could get updated fees. They're all staying with their current fees, except for Carver. Carver in 27 will be increasing, well, they're gonna increase it now for the year 2027. They're going up to $38. So since we don't fee exactly the same to do an apples to apples comparison, I did a per capita. So what you're looking at is the total revenue that we collected in 2019, and then I divided it by the population. So you'll see Scott County currently at $27, we're at just under $10 per capita. And then it says Scott at 38. We're not recommending 38, we're recommending 33, but I chose 38 because that's what Carver was doing at that time. So this just shows that if we did raise, we still are, raise our special assessment, we are still quite comparable to Anoka and Carver. We're staying within range of them.
The lowest on a per capita
Lowest
basis
on
on
the
the
per
metro
capita.
area.
And basically wanting to bump that up because we're losing so much to the state general fund.
Well, I would just say, it's not, the revenue we have from the state is not keeping up with our cost increases, right? This is same story as the levy. It's kind of, we presented in a way as the special assessment is the levy for these specific programs. And we're just not seeing that cost increase. And also what $1 is generating isn't keeping up with inflation as well.
But that's why we had Jake do that polling, because you've had the score as one of your ledge items before, right? That score is being taxed for this purpose. Why is it going to the general fund? If you took even a chunk of that and put it back to the counties, you wouldn't be having that special assessment, right?
It'd be lower. I mean, if you did the quick math on Kate's 2019, just for the metro, I think we were assessing about $70 million a year across the 7 counties. And that 27% that's going to the general fund would probably be in the $30 to $35 million a year range. So we'd still need more. We'd need some assessment, but the special assessment would not have to grow as
Right,
much as
it would,
has.
the special assessment would look different.
Yep.
And how might this pair with what might be potentially coming down the pike with this, what's the taxing district thing? Waste taxing district or whatever. I know this is HHW, but.
You're talking solid waste district, right?
That's different.
Well, but it's all trash, garbage.
And I think,
That's choice.
and that's pretty far down the road.
Nothing imminent, you don't think?
And I think it's just a mechanism to try and raise more revenue from
Right.
residents,
Yes.
so I'm not, yeah.
And so can you go back to that slide where it was the, like, what was it, what we're actually bringing in, actually what's needed? I just feel the, It almost feels worse than like fare recovery. All those same numbers.
They're pretty different than the fair.
Well, I understand it's two very different things, but the numbers, like from such a, am I reading that right? I mean,
Which number are you looking
well,
at?
if our revenue, a couple $100,000, and we need
That doesn't include the special assessment, right? The special assessment is the primary funder for this operation.
right.
Right, so that revenue, that's the, I call it the fee at the door, so that's the electronics, the appliances.
Right.
That's the paint care reimbursed for the paint, the light bulbs. So, even though that's a nice, projection for that we're gonna continue to get that increase, it doesn't, it varies, If we have a warm year, you see the fees go up because everyone's coming in. If we have a kind of a cold year, which you don't see a lot more of those anymore, so, that bounces up. But yes, our revenue coming in, other than the special assessment, it's a small fraction of the cost.
Other questions? All right.
All right, anything else on the preliminary budget discussions? Gonna turn it over to the AMC.
So in the interest of time, I'm not going to spend as much time on certain parts of this conversation. We kind of dove into some of the legislative items, but I want to give us a chance to round that out a little bit. So I've got a couple of slides that were meant to keep me on track, but they're going to do more than that because I'm going to go through them very quickly. So let me just set the stage by saying, I hope the commissioners all know, but there's a lot of folks in the room that I'm meeting for the first time, that our goal at AMC is really to extend the reach and power of each county, including Scott County, by harnessing all 87 counties in the same direction, which we've been talking about as we talked about each of the issues ahead of us. And so, just by way of reminder, we are governed by a 33-member board. We have 33 county commissioners on our board. So for those of you who are sitting closer to me, imagine that. But actually, we have a fantastic board. As I think everyone in this room knows, Commissioner Weckman-Brecky is our incoming president, will be president of AMC next year, so serves on the board, and Commissioner Beer is Scott County's designated representative to the board right now. So you have 2 seats of the 33 on that board. You can see all the different ways commissioners can get onto this board. It is a good spread of county commissioners from across the state. Each metro county has a designated seat on the board, which is one of the ways we maintain a good balance between the metro area and the rest of the state. The next slide, I'll just share that I think what we've been talking about today and what people are most familiar with is the work that we do in government relations. We do more than that. And I actually share this with the county board members because I want you to know that we want you to see value. I'm going to talk a little bit about ROI at AMC. We want you to see value in what we provide to you. I think you, as I said, primarily see that, I hope, on the government relations side. But several of the things we do are also revenue centers. We've worked really hard to diversify the way we bring revenue into AMC. At the end of the day, most of it's county money. It just comes in different ways based on how you work with us. So education and training is actually a revenue center. Grant services is a revenue center. We have a grant right now that is supporting some work we do there. Business solutions is entirely a revenue center. That is our kind of vendor marketplace. Sponsorships, etc. And then affiliate services is both a revenue center and allows us to bulk up our staffing with expertise. So by providing staff support to groups like SWA on the solid waste side or MAXA on the human services side, or name your county department, we're able to sort of match and leverage funding and boost our government relations capacity. So we keep an eye on that. Our budget is about 50% county dues. So the bill you get from us annually, each county gets, and about half of our budget is supported by dues, but the other half is coming into one of these methods. Next slide. So I said I wanted to talk about ROI. We have been keeping track, and each year we send you what we call our county benefits sheet that sort of itemizes the success AMC had in the past year, what that meant specifically to your county's bottom line, and then how your county has been involved. And I do want to talk about that a little bit. This is a selection going back, we did an assessment going back to 2019 of legislative success we've had in big areas. And these were some of the areas of success that we believe AMC led or contributed to that matter to your bottom line. Next slide. And over the course of, oh, that was supposed to be 2019, pardon my typo, 2019 to 2025, our advocacy on some of these high profile issues helped secure about $18.5 million in new or increased state funding, specifically to Scott County, and those are ongoing core county resources, and that does not include, you guys talked a little bit about how you've managed that federal CARES Act funding, but the work that AMC and NACO did to get that funding directly to your county budgets, which counties have used in a variety of ways. So that money is not included, that federal money is not included. This is also not trying to itemize what we see as avoided costs. So where we've been able to fend off some cost shifts, it's not included. This is just the dollars. So we think that by working together, counties can get more done because of the nature of having access to every member of the legislature by having access to every county in every corner of the state. But what we really wanted to talk about, and we can go to the next slide, is just stuff we've already started to touch on, which is how we're approaching advocacy right now, what's happened and what's at the top of our list. And so for that, I'm going to ask Matt to round up the conversation.
Thank you, Julie, and it's nice to meet you all. For those who I haven't had the privilege of meeting, my name is Matt, and I work as the Government Relations Director for the Association of Minnesota Counties. And I just want to thank Scott County for inviting us here and for inviting us the past several years to be part of a lot of your budget discussions. I've sat in this room at least a couple or a few times already when you had community members here and legislators here, but your staff, your leadership, your board has been fantastic partners. And I do think that part of the output that I'm so happy to talk about is we have partnered with Scott leadership for the last several years on some of our biggest issue items at AMC. And so there has been a Scott County pulse on all of the issues that matter most, I would argue, financially to counties. And I do appreciate that. I know you all have busy lives, and I know many of you, Joey, you too, on solid waste stuff, you have many different jobs that you also come to AMC postings and do as well. So I appreciate that. I do think one thing that I want to just capture quick for just good messages is just modernization was a huge victory last year, and that was a lot of effort between, frankly, Scott and Dakota County. It was a lot of counties, our entire state was talking about it, but I really do think about a few counties who lent professional staff time, another job, a portion of their job to come up to the Capitol to meet with legislators, to do your own demonstrations, to host people like Senator Port and others, and Senator Pratt, and do demonstrations there, and to have Senate hearings as early as last year in September, before even the legislature had commenced. We were having 2-hour-long hearings with Barb there, with commissioners there, testifying on what these technology limitations meant for services, for program integrity, and for property tax dollars. Now, this doesn't provide savings immediately, but the fact is, in a legislature that was equally divided in the House, where no one agreed on anything, and no one spent any money on local governments outside the bonding bill, counties were the only ones outside the bonding bill that saw funds. They saw funds in SNAP cost shift. Yes, they didn't pay for the whole thing, and yes, it was one time, but we saw some funds there. We saw funds in MAFBA, one time, again, but still 14 million there. And we saw $90 million with all 201 legislators voting yes for it, which is absolutely crazy for IT modernization.
Literally never happens.
And so that was a major victory that is all of us. It is truly uniting as, a fist and coming in and pounding on the table and saying, we cannot wait any longer. And that's what we did. And so I did put the Dave Beard campaign slogan, or his second one, which is spicy but nice, I guess. That is something that we've heard. I've talked to our AMC board before. It goes against the grain of kind of who I am as in my approach of lobbying, which is consensus driven and sometimes slower and cautious, conservative, because the long game of political relationships is that you will need people long term and you will need to rely on their vote. But I do think that this was a good message that we heard from you, which is loudness at certain core times matter. And I hope that you're feeling that your association is responding to that call. We still, you notice there's a lot of recent wins and then the same issues on the horizon, because it feels like these last 2 or 3 years we've just bought ourselves some time, or we've been nimble enough to pivot and like evade a jab. But there are some significant things that are looming in front of us. And the other thing that I'll just end with is this conversation that I felt like today was going into, which is, yes, LTSS waivers and SNAP are our biggest two asks, but there is something fundamentally broken in how we finance local government. And that's what Julie has kind of asked, and what our board will be talking about this coming week is we met with the other 4 local government associations who are great too, but I think we are the only ones that are putting together like a 25-page briefing for gubernatorial candidates, with some bold visions, some visions that we've already tapered down because they're too bold and hopefully don't get out in public. But the thinking is that we can't be risk averse. In the 1990s, Nathan Jessen, my good friend, he was MICA executive director, reminded me that this state had faced another local government crisis at that time, of which the Minnesota Miracle kind of came out. And the task from that governor at that time was to start all these different work groups, but to think outside the box and for bold visionary ideas. And I think that's what we're asking of our gubernatorial candidates around the areas of solid waste, around the areas of what's the county and state roles on health and human services and how we finance that system, around the areas of mental health. There's going to be a really strong conversation about mental health capacity. As you guys were talking today, there's 2 stories. The yesterday Star Tribune story that highlighted the fact that we have kids in hotels, and there's other stories that we all know where we are sending kids to different states. And the fact is we just don't have vet facilities. And so that's going to be a big, that we are going to probably get into some dispute with community providers and NAMI who want us to focus on continuum of care, building out providers. We understand, we support that, but for far too long we've been too hesitant to say more beds are needed, period. And in that time, the wait lists have grown just exponentially. And we have some people who are waiting for over a year to get placed at some high acuity settings. So that's going to be some of our messages. What I'm trying to illustrate is that there are critical systems aside from the most immediate cost shifts that seem to be buckling under the pressure. And we need big, bold visioning to look to these and say, how do we approach these differently? And there might be answers that we are uncomfortable. Surely there will be. But what we're trying to carve out for AMC is that we want both gubernatorial candidates to believe that AMC and counties in general aren't here just to say, it's broken, fix it, but we want to be at the table helping them with that vision. So there's risk involved in that, and certainly we're going to ask our board to clip our wings if we get too far ahead of us. And I hope they do amend some of our document just to say, ooh, be careful, or think about this too. But aside from those 2 immediate needs, which we are completely aligned on, we will be coming out with LTSS, protect those shifts from happening. We will continue to advocate our federal legislative, which I feel like Julie's half of her job this year, or another 0.5 of her job, has been lobbying the federal legislation on some of the SNAP shifts. We are going to be asking about the transformational kind of questions at its core. So thanks, I'll wrap up there, and I really, again, appreciate you guys bringing us in for the kitchen cabinet kind of conversation today. Thanks to your team for all the support they lent to, aside from the department heads, commissioners, working with Jake and Perry. You guys have a really good team here, so thank you.
Questions, comments for?
I think it's been a great opportunity, and I feel like, you at AMC have really seized that opportunity, because it does feel like, I'm sure some political capital got burned up, but seemingly money well spent.
Toward the right end.
And I also do feel like, remember, I've said this before, since old news, like I had a drug problem, right? Barb drugged me to AMC a couple years ago, and so, but I really have great confidence and belief that this feels like the time's right, feel like this org is the one that can probably move the needle by herding all the 87 cats plus to get on the same page or close to the same page. So I'm always optimistic, but maybe a little extra optimistic, but also real that it's going to be a big, heavy lift. So I'm hopeful that some structural things are going to change. And by the way, the spice of nice, I'm never going to advocate to be a jerk, right?
Yeah.
They might think you're a jerk because you're resolute and firm, and that will change, because I do think we're also truth tellers.
Yeah.
Like I don't think any of us, AMC, or people that are coming to these meetings are trying to make noise or political theater. It's just truth. And truth in Goosebumps is sexy on its own. And they may not like it and may think you're being a jerk, but the reality is it's courage, it's resolute. You have courage, I'm not saying that. It's being resolute, and like these things have to change. So many of these things have to change. I don't care if you're blue or red, they have to change. And I think that message conveys that it's not a political maneuver. It's just, because if these things do change, like every time I have a conversation, hey, blue team, hey, red team, you can spend all you want, you can cut all you want, but we have to change the way these things are delivered. Cut fraud, change the way things are delivered. You can spend all you want and it's still a lower cost of government, and hopefully better outcomes. So I believe that to my core, that can, it can happen. I don't know if I'm ready to say it will happen, but.
So Matt, I thought one of the things.
Not because of what you guys are doing or not doing.
One of the things that ended up working well last year, especially with the HHS modernization, was you had the short-term bridging and then you have the long-term. To me, we talked a little bit about it last week, but the LTSS and the SNAP seem short-term, can't slide benefit onto counties, which impacts ultimately then the property tax reshuffle. I think you're talking about who delivers what.
Yeah.
So I'm not sure how you dice and
tough.
spice that in the talking points, but that to me is what I'm feeling, or what I hear from our staff and our elected board, is those two bottom ones are short. You can't allow that shift, because once it happens,
Never get it back.
the property tax proposal then in the long term just becomes, it doesn't matter at that point.
Well, think about child protection. I think about that. We have 5% on disability residential waiver services. I forget the technical term, but if it starts at 5 in 40 years, we're going to be talking about, can you believe that counties pay 45% of disability waiver? Like that's, the writing is on the wall of where that's going to be. And on this transformational kind of change in roles, this is a tough one. We're live editing right now a document, and we're trying to send one more document out to our board with 2 days to go. But Angie Youngerberg has just been fantastic for us, like at this key moment, because she's balancing both the MAXA, the AMC perspective. We're here to serve clients, so that's perspective too. But this question of like, what are the appropriate roles, is going to be a tough one, and how strong we are in terms of saying take this or don't take this. And the way I think about these frameworks are, if you can't say that client outcomes are improved, that there are efficiencies in how we administer the programs or determine eligibility, and that we can rely on actual property, we can vote the property tax savings, then we should stop the study and move away. Like, the study has to be quick. The study has to determine if those things can be met. It has to have county involvement, and if it doesn't, then turn away. What I'm nervous about is that the state possibly has a retinue of services where they say, we could maybe take these over, mostly eligibility determination-wise, but at the end they give you a new cost shift and say, well, since we're saving you money, you're gonna pay a 10 or 15. That's unacceptable. So to me, the conversation is we should be clear that yes, study it, because frankly, the political pulse is, outside of counties, that's where both gubernatorial candidates are leaning. Study it. If you can guarantee the outcomes in those, continue moving towards a path, but if not, pivot back to addressing underlying system deficiencies.
You just go to 3 ledge auditor reports, right? HHS, the Met Council, and Transit. They didn't take one iota of that, but all of them had ways to re-look, rethink, redo that would be more effective and more efficient for folks moving forward. I liked your draft paper. The little draft we got to see of it. I mean, we're working on our own here, talking with them about some things. But I think incentivizing is the other thing, right? I mean, I look at the Metro Adams here and we talk about dispatch and the hiccups we're running
Yeah.
into with Hennepin and some of these things with Armor. But how do you
I like
incentivize?
this too.
Help us shift to the same system. You know, those types of things, I think were successful even back in the 80s, 90s, some of them. Jake's more on tune with it than I am. But I think about some of those things that we could do better as a region, right? And I think if we were incentivized to do it, it might even help some of the agencies move
Exactly.
on.
I really don't want to belabor this. I know we're at lunchtime, but I'll say two things. In response to what you said, Leslie, this session, I've been thinking about it a lot as acute care versus like long-term rehab, right? So like we are in the middle of like a widowmaker heart attack right now, and we have to deal with the emergency in front of us, get stabilized, and then we need like a long-term plan back to health. And trying to find, I think the most challenging thing for us in this space is how complex the programs are and how difficult they are to translate to easy, understandable solutions for elected officials. Each one, like I'll have a conversation with Barb and we just keep going deeper and deeper, and I understand why people walk away.
Totally.
We have built something that is not understandable. And so I'm thinking about our legislative strategy that way, acute care, long-term rehab. And I think for too long, we've worked really hard at AMC to move away in the last 10 years from identifying a problem and telling the legislature to fix it, to identifying a problem and giving them a solution or two. And I think that's what differentiates us in many ways, is trying to, legislators like you as commissioners are confronted with problems all day long and no solutions. And so we, 10, 12 years ago, said our legislative priorities are going to be solution focused, not just give us more money. Give us more money is the solution to a lot of problems, short term, but it's actually not a solution that works. And the legislature can't, if everybody just says, give me more money, then they gotta pick who's most worthy. And honestly, you have taxing capacity, so you seem less needy than somebody else with their hand out. So how do we talk about redesign? How do we talk about better service, better government, a new version of government that is compelling to the people that are being elected, and hand them some ideas? Because otherwise they're gonna sit down and talk to their agency people and feel like I do when I talk to our county staff, where you get to a certain point and your brain is just like, I can't figure this out anymore. So I think that's where we have a different focus than a lot of other groups, and it's what's made us successful. The second piece goes back to what Commissioner Beer said, like regardless of what color your stripes are, the power of an organization like AMC is we've got the rainbow, like we've got all the colors and the non-colors in terms of political point of view and relationships. And the board's gonna be thinking about this, how to remain a known, non-partisan, policy-focused organization, but understand the politically polarized situation we live in today, and how to make our message understandable and compelling to elected officials who are deep into partisanship at the state and federal level. That's who we have to convince, and we have to kind of meet them where they are. And being statewide, we have folks who can meet them where they are. So we're thinking about how to do that in a way that fits with our core identity as a nonpartisan, voluntary, policy-focused organization, but one that gets things done. So I think Matt and I both probably are known for being nicer than spicier, but I also think in the last year, our reputations both have changed. Our impatience is showing, But we're trying to show it with a direction towards solution, and hopefully that gets us somewhere. And we're forging new ground. This is the challenge. We tried really hard looking at our fall policy conference. We keep hearing about other states who are doing human services differently, and Colorado is supposedly transitioning some things from local to state. And as I talk to each of those states, like, none of them are really doing that. That's not exactly what's happening as you dig into it. So we are trying to forge new ground in Minnesota, which we're good at, but is not in itself easy. So it's gonna be a interesting year to just close on a very Minnesota note.
I was
I
putting
want
that
to
exact
say a
word.
couple, you're optimistic, I'm less optimistic. As a county commissioner all these years, we have valued highly being nonpartisan. We
Yes.
enjoyed that we're not in the partisan arena politically, and that's been great. However, there's a movement in our country, in our state, in the metropolitan area, and there's a strong belief that we're not taxed enough.
Yeah.
And
That's true.
and it's crazy that is there. One of our state representatives has come back and told us we're not taxing our people enough.
Yeah.
More than one even.
And I've noticed over time that we have state representatives that don't represent the people at all. They represent an idea or a political philosophy, and whether they're conservative or liberal, it's been true on both sides, where they hold to that political philosophy, but don't really represent the people, and that's terrible. There's some undercurrents there. Question: do we have to become more partisan? Do we have to have make some forced accountability? I mean, I just don't know the answer, because it'd be terrible to give up that nonpartisan dynamic that we have. I don't know the solution, and I got to tell you, as I'm reflecting more, because I've only had about 4 months to be a commissioner.
And a meeting in November.
I'm
Awesome.
researching that. So it's frustrating to have these dynamics at play, and I don't know if I can say more.
I feel that. I think there is a mood right now that is really challenging for us. And we are thinking a lot about, like, I think the best thing that you all have as elected officials is being able to be elected on a nonpartisan basis. When we look at other states across the country where that's not the case, the intensity of what you're talking about is harder. But that said, many, many county commissioners are affiliated locally with one side of the aisle or the other. They get involved in local politics on one side of the aisle or the other. And so I think it's important for us to think about how to be both nonpartisan and use the political relationships we have to achieve our goals. And I think, for me, one of the ways we can do that is if we are, as a state, unified around the fact that shifting a benefit cost from state or federal to local is bad policy, and if county commissioners who are identified on either side of the aisle are saying that same message, it can become a nonpartisan message.
Yeah, but when is it just yada, yada, yada?
Yeah.
I mean, you're requiring more, you're giving us less, we don't have enough money to do what you're asking. I mean, that's like a broken record,
Yeah.
really.
Yeah.
When did they just stop listening to anything related to that message?
I think there's a couple things. I do think that has not been a leadership moment in the last 2 years where a House or Senate leader or a governor has said, listen, we are not ending the session until we address this cost shift that's looming or change the fiscal narrative on this. I also think the other thing, I was listening intently to what you said about the personalities and kind of styles that we're seeing in kind of elected offices coming up. One thing I noticed is the lack of county and local government experience. And
At the legislature.
we see the reverse happen. We see legislators become county commissioners and oftentimes say, man, I can't believe, we didn't address this back then. Or, I love, and Dave Centrum lets me use this, but him saying, I would have known mental health, I would have used a third of my bonding bill, I would have built facilities, and I would have told DCT to just, to service those. I was like, man, that would have been a vision. You would have literally had a legacy for an entire generation. So like, part of, Julie knows this, and maybe this is a fool errand, but like, part of my thing is we need folks going the other direction, because right now the caucuses are really light on that local government story. To what you said, how many times someone says they'll pay for it?
You know, county commissioner pays double to triple what a legislator pays. I mean, so why would you go that way?
You know he's got a write-in campaign coming up.
No,
Yeah,
And not local. Not local.
never mind. Anyhow, but that's why, you know, you see that shift. I asked Deputy, what are you gonna do when you wanna grow up? Do you wanna be a county commissioner?
But Julie,
You
I
wanna take
think,
them?
Julie, you are on the right? As we sat and brainstormed in our little group, it was, we should not be paying federal and state programs. I think it does go back to state bonding. I started, in 1985, and working with legislatures in 1990. You did not see local plants, local this, local roads. It was the state schools, it was the DNR, it was MnDOT. You might go after a trunk highway bond, but maybe not. That is a huge transition to where our bonding has gone in the last few years. That's part of the issue. I mean, shouldn't there be some statement about, it really should be a statewide impact, or at least a regional impact to be state bonding? That is a huge, huge transition, because once you start down that road, Claire Roebling said it, you can't go back, and it just becomes more and more and more. I'm sorry, but the city of Jordan, if you can't afford your $5 million for your sewer system, should you really be growing? I think that's a legitimate discussion to have. I understood, they always had some of the small outstate cities that were declining population, the state might have to step in and help from an environmental standpoint. But it wasn't a huge amount. That is a huge change in bonding.
She may have a little issue with the local.
I just want to say, Julie, Matt, thanks for sitting through and listening.
Yeah.
You know, so many people come and they give their presentation and they gotta go. And so I really appreciate that you're willing, you know,
When you came and stayed all day.
And hopefully, it just gives you a flavor of what we're talking about and dealing with.
I don't feel like I'd had a real day if I hadn't started it with the pledge. And I did want to say that I really appreciated being able to sit in on the FRC conversation, because that is a place where Scott County led.
Yeah.
And when I think of AMC as this exchange of ideas, right? We work on behalf of all, but it's also a chance for counties to learn from each other. Your FRC model is, like, by every measure, doing great things in terms of budget management, better outcomes for people, and now a whole bunch of other counties learned from you and got the benefit of that. And that will transform impact for people and those counties' budgets. So I neglected to say that when I started, that it is actually really nice for me to be able to come and hear stories like that. And we appreciated being able to jot lots of notes during your budget presentation, because we need that level of
Fluency.
and example to make the case. A lot of closing remarks, my apologies.
Thanks, Catherine.
Thank you, thank you. Yeah, it was good. Really appreciate it, and appreciate your work, and
They have to deal with me, are you giving them condolences?
Represent the people.
Condolences.
Not at all.
Commissioner Round Robin,
Oh, round robin.
do you have any?
Nope.
I think I've said all my things.
What's wrong?
No, no.
I do. I think we should have a conversation about camper cabins. I know that there is a conversation to build more camper cabins at Cleary Lake. And I think our camper cabin numbers are going down in Cedar Lake. Cedar Lake. And should we continue to do that? It had been my understanding that that was something that we were going to wait and see what the impact was of the current camper cabins, what the impact was and how they were going to be functioning. And then I think that is something that was.
Well, just if I could make a quick comment on this. I have maintained for a long time that the structure that just doesn't work. I mean, they will rent a two-night on a summer weekend. I said, in the summer, you gotta rent by the week. You're burning a week for 2 nights. A vacation rental at a popular like lake place, they would never rent 2 nights in a weekend. It's a week long. You can do the weekend thing the rest of the year, but not June, July, and August.
I also know that it's like a lot of trying to maintain the camper cabins. I think it's like 45 minutes to clean a camper cabin, to turn it over, plus the time that it takes to mow around the place and graffiti and cleaning the showers. So I guess I'd rather
I think
have a
we have
better
that discussion.
understanding.
So that
I'll
this
give
will,
one more thought. I'm sorry. But that's why I said in the beginning, 3 or 4 is not enough. You have to have enough scale so that there's enough revenue to support a position, you know. So, it gets more scalable and if you have more. But go ahead, I'm sorry.
this will be part of the capital improvement program. That's where that comes up in that discussion. We'll have camper cabins highlighted for part of the discussion point. I think staff feels very strongly that Cleary will have a different experience because of its population and where it sits versus Cedar. But I don't think they're down on Cedar Lake. I think they still support the camper cabin and including them in the Cleary Lake. But this is part of the discussion when we do the capital plan, because you will see that as a highlighted project. And that comes in early September.
Yeah, on our weekly report that we get for commissioner report, it does show the numbers are going down.
Yep, and that very well could be. I don't know the specifics of that, but Patty's been out of town for 2 weeks.
Yeah.
So I haven't been able to ask her that question, but that is coming up as part of the capital investment projects.
So I agree with you. You gotta analyze what's happening with the rentals. And are you making a mistake in the way you're structuring it?
You've been saying that from the get-go.
Right.
But we'll have time for a real conversation.
Yeah,
I think
correct.
that's the thing.
Yep, that's part of the CIP. That's coming up. Commissioner Beer?
Just November meeting attendance.
Mandatory.
You wanted it on Thursday.
No, I'll be there.
Oh, good.
I just thought it would just be for others a nice topic.
I've been researching it, but getting
Mixed
feedback
mix.
from prior commissioners. Was
Yes,
Wagner
they-
there?
Well,
No.
Yes.
I know Joe was, but Mike was there on his last.
There are discussions on the
Yeah.
budget and approvals for December, so you are required to be there. You don't have to be there in the afternoon.
Okay,
Usually we have
some stuff I have to be there in the morning.
Right,
okay?
we have structured it sometimes when we've had a changing of the guard, because the afternoon could be the appointments for committees and
That's
things
right.
like that.
Okay, I'll be there.
Yeah, but we'd really like your input on what you think we should do.
Especially since it's untethered to being elected or not.
I have a lunch date.
Happy birthday.
Happy
Yeah, happy birthday, happy birthday. Happy birthday.
We thought AMC was buying pizza today, but apparently not.
I guess you'll have to have us back.
Happily.